So here I have Niharika with me, who has just come back from Cannes Film Festival, and I'm so proud of her to what she has achieved. I've seen her through all.
I mean, the first time we met, I was back in 2021, if I'm not wrong. From there till here, it's like long journey
to everything, to her skin, to her life. I've seen it all ups and downs in her skin and her life.
From the worst skin possible when I came to you first time, she was like, "Your skin jala kisne di tumhari?" To now, I have flawless skin thanks to her.
My pleasure. I'm glad I could make it work for you. And when you announced, I was so happy for you, and I felt, oh my god, this girl really truly deserves.
Thank you so much. So I got to know that I'm going to Cannes Film Festival like 1.5 months ago, and then I came to her. I was like, listen, my skin is not performing really well right now. You have to do something about it. And she was like, calm down, we'll do it. And she actually did it like within, I think, one month, 15 days.
Along with her so-called busy travel.
Travels and everything was going on. Still we managed, and I mean, it was great. It was just great.
Being very accommodative to everything that I'm like, Niharika, I think I need to do it. No question asked. She's always up. Okay, let's do it.
Because I trust you completely. I was like, don't ask me, just do it whatever you want to do.
That is the kind of trust which made me also, okay, fine, let me just give her the best. I'm going to work on these lines, and so first and foremost, ये काम करें, ठीक है? Then we're going to work with little bit of a tightening and contouring to lift and reduce these lines.
Okay.
Right? Alongside, I have a plan to work on these scars, and lastly, I'll do a skin booster.
Okay.
Right? That skin boosters are hyaluronic acid based filled syringes. They will give you the very nice, if you have seen their cheeks and all and everything, when the light reflects on it, look very bright and shiny. And that's important to have it actually. So when somebody, patient or anybody is coming to us, I always tell us, either you leave it on me completely or you tell me what to do.
Yes, exactly. I mean, trusting your dermat, your gynae, like all your doctors is very important, because if you're not trusting them, you are not trusting the procedure that is happening, and it's not going to show eventually, because you will be doubtful to kaise dikhega.
True. So before we begin with your journey, tell me your experience there. How was it? How did it go?
Oh, it was so hectic. It was too much, to be honest. But again, a very nice and new experience for me, because I had never been on a global stage before. So working for it, being there, performing all the things that I had to. It was a great experience. Crying 1 minute and then showing up on camera with a smile. I mean, crazy.
I'm sure it is like you have to pick up yourself and go big. There's no second thought. Even you're not ready, you're ready.
Yeah, exactly. I mean, even when you are not ready, I mean, literally before walking the red carpet, like 2 hours ago, I asked my manager, can you please skip it?
Oh my god.
Can I not go today? Can I go tomorrow? This is what I asked her, and I have it on my camera, and she was like, are you crazy? Because nothing was going in our favors. It was just going left, right. So, but we made it.
No, that's how you are. I think what you're doing throughout your journey always. That's how you always been, and I've always seen you. Wherever there is any issue, you're like, okay, chalo.
Kar lenge, ho jayega.
That's how I think life should be with everything. Okay, so let's talk about which people also understand what all we did and what all you had. So just first, you tell me when you had come, what all you were facing and what all I did in that segment.
So basically, I think I told you, I'll tell them that I was building my own place, so there was so much, pollution. The construction pollution was there, because of which my skin was acting up again. I had pimples all over my face, and the older pimples left so many scars here. Scars, dark spots, everything was there. Plus, I have like very deep smile lines. I am representing India in Cannes Film Festival.
Wow. Oh my god!
So we are going there mid-May, and I want you to help me with my skin.
Congratulations!
Thank you.
So proud of you.
Thank you so much.
Wow.
months now, so care to बिल्कुल भी नहीं हुआ है.
And now you have to represent you
actually.
so
It was like smooth, no wrinkles, no smile lines. So yeah.
that's great.
Oh my god, this is so funny. The first time I came to Dr. Radha, she was just checking my face and she was like, "Do you laugh a lot?"
Yeah.
I was like, "Do you laugh a lot?" I was like, "Is that a good question or a bad question? Should I say yes? Should I say no?" I was like, "Yeah, I do because I'm always on the camera." So that's when I introduced her that I'm a creator.
Yeah.
So that's when she told me that I can see some smile lines.
Because they were so deep according to your age. Sometimes any unusual thing comes up.
Yeah.
We always check with the lifestyle or the habits or the pattern of a person to figure out that no, this is not normal. I'm sure there is some story behind it.
Yeah. So from then, I mean, that was 5 years ago when she asked me to now. I have even deeper smile lines now. So she was like, that was there.
This is your work talking and your hard work talking. All scars are now.
And then now I have gained this chotu sa pouch also here, jo bada tha pehle. Now it's a little settled also. So yeah, all these things were there. And I wanted my skin to be, to look like very fresh and just glow from within.
You need minimal makeup. That's I think what we should actually trying to achieve at that point of time.
So these were my problems, and then Dr. Radha suggested all the treatments that she is going to talk about now.
So let's come to step by step how I started, what we did, because I only had 1.5 months to work on you. That I'm going to do. You said 15th May is you're going now. So that I'm going to do a week or 10 days before you're flying.
Okay.
Because that has a downtime.
Okay.
So all injectables that I'm talking about. But it is a very nice hydration to the skin. Whenever you're doing day-to-day makeup, your skin actually prep first, well hydrated, and this area looks very shiny and glowing. It's most of your highlighters and makeup is reflecting really well.
Yeah.
So that we're going to do the whole area. Coming down to your little bit of a brightness and the tone that we need to work all and acne. I will definitely start you on some oral medications also. So my thing was let's work on something which will take time to show results. So and something which require multiple sessions, something which is deeper concern.
Yeah.
So we started working on your face contouring first.
Yeah.
Because as I explained that time also, you had a very heavy masseter.
Yeah.
So this was literally pouched out. So masseter, I have a similar problem. But that's something.
It's very masculine, by the way.
Yeah, it is. So having these heavy masseter is a manly look, what we call it. Females generally have a very smooth jawline in specifically this particular area.
Yeah.
People do have some medical condition also, what we call is teeth grinding, because of which this become very large and this become hypertrophic. So we did reduced with Botox masseter. Don't get scared. Botox is absolutely, as she's sitting here.
I was scared. I was, what are we going to do, doc? Is it some kind of surgery? Is it? I had some stupid questions to ask her, but she was like, yes, it's nothing.
And Botox fillers are always scary to hear because the kind of, I think the kind of shift that this one thing has taken last few years is people don't understand that doing it in a subtle way, doing it in the right place always works best for you. But never overdo it.
Yeah. I think we just did one dose.
One dose, that's about it, and that's more than important. To just slightly, my intention was just slightly soften this down. And after doing the Botox masseter, which really reduces this heaviness of yours.
It did, for sure.
Yes, then we did HIFU, that stands for High Intensity Focused Ultrasound, for which this double chain.
We did that.
And because that actually shows up, and no matter what you do, makeup cannot hide it. It
just doesn't.
So that one thing which I wanted to, that's why I choose to do Botox masseter first. So if there is any sagging, little bit of jowl which might come after Botox, we'll be able to address that also. So after doing your Botox, we did HIFU. HIFU does definitely reducing your heaviness. It is working on excess fat cell, it is stimulating your collagen, tightening your skin, contouring your jawline, reducing your jaw, and this double chin as well.
So overall, we worked with that for your
Yeah.
face to give a little contouring, lifting effect, and we did bit of your laugh line also
laugh line
with that.
also, yes.
So we have because since we're stimulating the collagen, and that's why we picked up as the earliest appointment for it, because it takes almost 1 month for it to work.
Yeah,
So,
I remember that.
Tell me your experience with HIFU. How was it? Was there any downtime? How had you felt after that?
I mean, while we were doing it, I was actually scared. I was like, talk, talk. But then I didn't even feel that something was happening. Just here, I think I felt a little bit of this thing. After that, I think for a week or so, I just had some pain here.
Soreness, yes.
Yeah, here, like when I used to chew, तो मुझे feel होता था कि कुछ कराया है मैंने. Otherwise, it was just fine, and it like downsided after a week or so. Yeah.
But there's no pricks, no needles, no cuts.
Nothing. I mean, I don't think we do that, right?
Nothing.
Yeah.
We don't. We just deal with only the needles, which does not leave any marks behind.
Yes, for sure.
So right after that, I've started working with microneedling and PRP.
Yeah.
That's my absolute favorite when I'm working with scars.
Yeah.
So you had those scars which was left behind once your acne got healed. They're the tissue loss, they're collagen loss there. So we need to stimulate that by doing microneedling. At the same time, if we do PRP, they are complementing each other.
Yes, right.
PRP is something which we withdraw the blood, then we centrifuge, we extract the plasma, and alongside doing microneedling, sounds so scary, but
it doesn't hurt. I mean, they
hurt.
put that cream on your face for the anesthesia that they do, and it's there on your face for like 40 minutes, and then after that, even someone punches you, you are not going to feel that someone punched you, so it's just fine.
And PRP actually, it's a natural collagen stimulator. We are not injecting anything from outside. We're using your own body plasma and infusing into your own skin. So that's nothing artificial we are doing. Right? So it is important that you should be as gentle, as mild as possible. And since we are combining with microneedling, already we are boosting collagen. So plasma or PRP enhances the result of your existing microneedling session, because this is also a cell growth factor. So since we are working on your collagen, it will enhance and work further in the collagen production. So that we did, I think, twice, so we could only manage to do it 2 of it.
But still, I see a lot of difference. Like I had, so you see those gaddhas that happen on some faces, right? Those gaddhas are the scars. The dark spots are not the scars. The gaddhas are the scars.
I'm glad I've taught you well.
Student, nice student.
Yes.
So the gaddhas, they are not there anymore.
Exactly.
Like I have a few still, but the ones that I had before going to Cannes, it was like crazy.
It's pretty deep pricks. And the one thing that I tell everybody, and that's one thing one needs to understand very clearly, that if you have a scar, it will always and always remain scar. We can make it look better. I can treat it 80%, 90%, 95% if you're too fortunate, which is rare. But for any dermat to completely make it go like nothing was there is not possible. So you can make it smoother, you can make it superficial, but yes, the scar will remain there. So better get your acne treated than treating your scars later.
Yes, exactly. I mean,
So, acne is something which is a very common problem nowadays, and they need to be
because
treated.
of the lifestyle also, I feel, and whatever we are eating, we are not exercising, and the
hormonal
care,
fluctuations,
hormones,
kind of
everything,
stress we go through, and as a female we go through a lot of hormonal ups and downs. So I think we were focusing during that resurfacing, and that's what my intentions was, because since there's a constant makeup is going to happen, and if you don't treat your pits, then the makeup sets in there.
That is true. I mean, that used to happen to me before, but now, I mean, yesterday only I was talking on my story, makeup is the flawless lag raha hai, guys, maze hi aa gaya. And that flawless is because the gaddhas are not there anymore.
Exactly. So that works. You can hide, right? But you cannot fill anything with the makeup. So my intentions is always, whenever even for you preparing for any event, or for that matter, I have my brides coming up, I tell them, let me give a canvas for your makeup artist to work on.
Yes, exactly.
Right? They're going to make a beautiful picture. They're going to paint on your face. But the painting comes out well if the canvas is smooth, it's soft.
That is true.
So we work absolutely on that. Coming back to your pigmentation that we were working on. And lastly, what I did was skin booster that I'll talk later in the end, which is the most favorite of mine in the whole segment that I did.
I still have the glow.
Yeah. And I told you it gives that, you know, when you're putting a highlighter and on, and I absolutely love what, what it comes out as. So doing your Q-switch laser, that's quality switched anti-acne laser for your black spots and pigmentation.
We did that for my legs also.
Yeah, absolutely. And with the peelings also we did with chemical peel because you had your ingrowns, right?
Yes.
And whenever, that's why we were discussing that it is so important that you take laser heat reduction for all your ingrowns, so that you're not leaving those black spots behind. Those black marks, once you get the waxing done, the redness, red bumps, once they heal, they leave those black dots.
Black marks, yes, that is true.
And that's why treating your hair, then treating your black marks, just start your laser hair reduction, so you're not treating two things. You only have to deal with one.
Yeah, I mean, literally, when I started the laser hair reduction, I think after that, I do not have any new black marks on my legs. It's just the ones that I have from past.
Yeah.
And now we are treating those.
Treating those.
So double treatment.
Yeah, so that's why I always recommend for strawberry and ingrown, just don't think about it. Start your hair reduction, that's necessary and must. So we did that with the lasers, and for the face also and for legs, both we tried. The face we didn't do peeling because peels have downtime.
Yeah.
And we didn't have much time.
I did for my arms though, like for the upper body,
body
because I was wearing like tube tops. So yeah, we did that.
We did for the brides also because it's more exposed area. So it should not look pigment or when your face and the body.
Although I got tanned there.
I'm sure.
Before the red carpet. I was shooting.
Tanned at can.
Yeah. I was shooting outdoors like permanently. My interviews also are outdoors. Yeah, so I got tan and I have this in my vlog also a day before my red carpet because my red carpet day was like the last day.
Oh,
I had 2 days prior to that, like all the events.
Outdoor events.
Yeah. So I got tanned. I get tanned very easily also. I'm saying in my vlogs, listen, my foundation shade is not matching anymore.
And you get tan and the tan starts reflecting in a day only if you're exposed to the sun. And the kind of, I'm sure sun is there. You must be enjoying though the kind of cold.
It's so cold there. I mean, in May, like your summer is a scam, bro. There's no summer there. It's just cold there.
Yeah, true. So imagine how the winters was happening in the summers is this.
I have been there in winters also. I don't want to speak about
But
it.
not in tubes, huh?
Yeah.
In tops
Oh
and
my
all
god, that
dresses,
is true. Yeah.
Shorts, and then you're showing up out. Yeah, that's true. So that's how it worked on our black spots. And a little bit of we need to brightening also to be coming up on the face, and the even tone which was there we needed to work on. So that's why we work primarily with the Q-switch laser. And lastly, we did a little bit of a facial that I like doing. Hydra kar lete thoda sa to hydrate, and a little bit of a pumping to enhance the brightness. But that's the one which is only for the enhancement purpose. That's only last minute things. Q-switch is something which is going to treat, fix all the black spots and marks and all everything. Besides that, one thing which is skin boosters we did, and that's one thing which gives actually genuine results. Whenever you've seen all the light reflecting, the cheeks which is looking dewy, which are looking brightened and highlighted and all and everything, is all due to skin boosters.
My makeup artist, she was from France only. She came in one day around 5 a.m. Okay, I didn't even wake up. She came. That's when I woke up. And she was like, oh my god, you're sparkling. What did you put on your face? I just woke up. I didn't even wash my face. She was like, oh my god, you're glowing. I was
It's
like,
my skin booster. Okay. So that's one thing I was telling you, that one thing that you do it because honestly, I recommend. I took it on my wedding, before my wedding, and it's like something which I genuinely enjoyed. And all the pictures and all things, it comes out so nice,
Right.
and it reduces that unnecessary highlighter that you
Yes,
need.
she didn't put any highlighters on
Wow.
me. She just didn't. She didn't use highlighters only.
Lovely.
She was like, we are okay with your skin as it is.
Yeah, and it gives a very natural, dewy, glassy skin with something which everybody claim ki, oh, how does it come? You can never topically hyaluronic acid because skin boosters is nothing. It's just hyaluronic acid.
Yeah,
that's all.
She told me,
Which-
like when she was opening, listen, this is hyaluronic acid, and you're just putting this on your face. Don't worry about it. It's nothing else.
And this is present naturally also in your skin.
Yeah.
Whatever the product, it comes in a formulation actually, which is only to protect your skin moisture. They provide a film, but they do not do anything internally.
Yeah.
Something that you require, a good hydration. And skin boosters, if you're doing it, it gives a very hydrated looking skin. So your makeup also sets in so well, besides this giving you this
Right, that is true.
glowing look and all and everything. That's why I love it the most, because something you really need is hydrated skin when your makeup artist is working on your face.
Yeah.
So that's quite of all, besides a bit here and there. But during everything, I must say, she's been very, very supporting with me, and whatever I had to come up with, okay, now let's do this. This is the concern that I'm facing that we need to treat and fix. And then figuring out, okay, we need to do this before she goes. And I'll, Acha, can you come 3 days later for this? Can you come 1 week later for this? Always, yes, doc, okay, fine. So that kind of
I think
support.
this past month we saw each other more than
Yeah,
the times we have seen in 5 years.
True, every time, and it was more of kind of trust that people put in. That's important. That only and always gives the best result in reference to your skin and hair. Trust your doctor. Find a good, trusted dermatologist, qualified.
That is very important. I mean, when I came to you before that, one doctor literally burned my skin. That's when I came to us. Maybe skin jawline है इसको ठीक कर दो please.
And she had actually come to me as like, हाँ, अभी मेरे को सिर्फ I'm here as a patient to see me and then treat me, and then later we build up a relationship. That's how we gone this far.
Yeah, exactly. I mean, first you go to your doctor. I would suggest if you're from Delhi NCR, just come here only. She is the best. I mean, you are not going to find a dermat like her at all.
Thank you.
No, you have shown results and you're so sweet. I mean, whenever I come to you, I'm never like, nahi ho payega Niharika. एक महीने में skin ठीक करना is not possible at all, but she did it. So
I like to take up the challenges, but at the same time, your support was something which is tremendous. For anything and everything, it
was a teamwork, guys. We will conclude it there that it was a teamwork. So yeah.
So lovely talking to you.
Likewise.
Congratulations.
Thank you so much.
I'm
We're
so
going to
happy for you.
achieve so much more and keep doing the
good work.
Yeah.
Thank you guys. Okay, thank you for watching us. Bye.
Bye.